and welcome to all of our Gold viewers who are here with us today. I'm Kristen Schwartz, licensed midwife and one of the MCs here at Gold. And today I'm here chatting with Dr. Alexandra Ullsten. And Dr. Alexandra Ullsten will be holding a presentation here at Gold titled Family-Centered Music Therapy to Manage Pain in the NICU. Welcome, Alexandra. It's so good to have you here today.
Thank you so much. Thank you.
So before we go into the topic, which I find absolutely fascinating, tell us a little bit about yourself. And first of all, where in the world are you, and what is your professional background?
Okay, I work as a music therapist in Sweden and in a small town called Karlstad. It's about 2-3 hours west of the capital, Stockholm, in Sweden. And I work at the Central Hospital in Karlstad, and I work with all ages and all kind of patients and diagnoses, but mostly with infants and their families in the neonatal intensive care unit at the Central Hospital in Karlstad.
Wonderful. Let me ask you this. Music therapy, is that something that is very common in hospitals in Sweden, or is this something, because honestly, if I look around here in my hospital, I don't know that we have a music therapist here. So is that something that is now up and coming, or is that a very unique position in the hospital where you are?
Well, music therapy has been at a hospital, introduced in the hospital 30 years ago. So
Wow.
it's been for a while now.
Uh-huh.
But in the neonatal unit where I work and as a music therapist and a researcher, I pioneered the implementation of music therapy here in Sweden, starting here
Mm.
in Karlstad in 2010. So it's been here for 15 years now. So it's not up and coming. It's not very common yet, but it's getting there. It has
Mm-hmm.
been spreading to the big university hospitals in Sweden and also in other hospitals in the Nordic countries. I'm one of the trainers educating the next generation of the neonatal music therapists here
Oh.
in the Nordic countries.
Absolutely love to hear that, and I hope more it will catch up all over the world. This is such a beautiful thing. So tell me a little bit about the work you're doing with these little neonates and the families, because I feel like there is a big difference if you are teaching or talking about even full-term babies and families than these little ones that were either born very early or have medical conditions so that they need to be in the NICU. So tell us a little bit what your day there looks like.
So I usually meet the families in the family room. We are fortunate to have separate family rooms in the NICU here at the hospital where I work. And I always use lullabies as the first entree when I meet the family. And the music that is the family's music. That is the
Mhm.
most important music because that is kind of music that an infant has heard from being a fetus. So even if you're prematurely born, you have heard some of the music and the sounds in the outer environment from start. So I start with the family's music and introduce them to connect with their infant, to interact with their infant, but always monitoring, of course, the infant's state and affect
Mhm.
state, so it will not be overstimulating. But it's no risk actually with the singing that it will overstimulate the infant. So it's actually a process of connecting all parties here in the families to have the attachment process going on also starting in the NICU, so it will not be postponed, but
Mhm.
start from the very beginning to connect to each other. And I work a lot with psychoeducation when it comes to pain management, to involve the parents in pain management and also in pain assessment, so they can be the deliverers of the pain management, because that's really the best kind of pain management we have for the infant, not to be separated during the painful
Right.
procedures, but also connected and attached during these challenging situations.
Right. And it also gives the parents a way to be a parent, right? Like be with these little ones, because often, I don't know in Sweden, but here the NICUs are very obviously medical. There's a lot of attachments and noises and procedures, painful procedures. And often parents feel like that they are on the outside of care, that the care is provided by nurses and doctors, and they have no way of really caring for their baby. And this is a wonderful way to bond with their baby, to parent their baby as well. And now tell me more about the pain management. You are a researcher, you have created a study around that. So tell me more about this study.
Okay, so the study is divided in two parts. It's one qualitative part and one quantitative. It's mixed methods study. And what we actually do is to involve both the healthcare professionals and the parents in this kind of in the research, because we think, aligned with family integrated care and family-centered care, that the parents are experts on their infant. And in a collaboration, we are actually offering the best care for the infant when we collaborate together with the nurses and parents, and in this case, also the researchers. So it's like a democratic way of doing research, and I prefer that with participatory action research. And we also tested the parent-led pain management, skin-to-skin contact, breastfeeding if possible, and the parents live singing. So we combined these interventions and found out that it is feasible for both the nurses and the parents to use these interventions in the NICU. And they also have a very good efficiency when it comes to pain alleviation.
And this can be measured, right? Like this is it measurable that, what influence that has on pain and if it really helps with pain?
Yes, we do a lot of assessments and measurements. For example, we do the PIP-R, the Premature Infant Pain Profile revised assessment tool we use
Mhm.
to assess the infant's um, pain expressions during the painful procedure, the blood sampling procedure. And we also assess the galvanic skin response, so the sweating, the stress, sweat underneath the infant's foot. And then we have the parents to assess on VAS scales their impression of the infant's stress and pain. And so we have a lot of measurements to actually assess the pain in different conditions, in different groups we are comparing.
Fantastic. Well, that sounds absolutely wonderful. It sounds fantastic. And I can't wait to learn from your presentation from you here. My question is, were there any barriers when you are trying to, start the project, start this in the NICU? You said you pioneered this. Were there any barriers? Was it hard to implement, or was it all, relatively easy, everybody on board?
It was a struggle from the beginning to, as some of the nurses said, add music, add noise. They called music
Mm,
noise into
noise.
the NICU that is already kind of busy. But afterwards, when they rebuilt the NICU facilities with separate family rooms, there were no problem at all. Music is not noise, of course.
It's
It's organized sound in a way that I use my expertise to have goals to regulate the infant and the family stress, for example, is used to enhance to make the vital signs of the infant better, better
mhm,
heart rate, better oxygen saturation rate, etc. So it's well researched already in in a non-painful context. But when it comes
mhm.
to painful context, music therapy is not so well represented. And that is why we do this project, because now we are, I am pioneering this field with
Yes.
music therapy included in a collaboration with the nursing science.
Beautiful. That sounds wonderful. Have the parents, out of curiosity, have the parents been measured? Because I can also imagine that their stress level is going down. Seeing their baby having a painful procedure is very hard. Having a baby in the NICU is very stressful. Is this part of singing, holding the baby? Is that also something that could regulate their stress level as well?
Absolutely. There's a lot of research done on parents too. When they sing with their infant, they will regulate themselves even better because
Mhm.
they will breathe deeply, and deep breath will really relax people. So singing is beneficial for both the infant and the parent. It's not just the attachment and link between them, it's also beneficial for both parties on their own side, so to speak. So it's a lot of going on. Singing is not just singing. I mean, singing is a communication. And when you communicate with an infant in a sing-song-like way, the infant
Mhm.
will understand instantly the message in the melody. So the parents' love and devotion and care for the infant will be transferred through the voice to the baby, and this is really fantastic to see. I see it every day in my clinical work, how the singing is kind of facilitating a lot of communication, a lot of emotions here, and a lot of good things happening. The hormones, oxytocin, and endogenous pain relieving hormones also. So we have a lot going on with the singing. Singing is really a resource, health resource for both the parents and the infants,
I
together
love
and
this.
separately.
I love this. A health resource. Absolutely beautiful how you voice that, and a way of communication, a great way of communication. Before I let you go, Alexandra, any final words for our viewers? What you hope they will take away from your presentation?
I will end the whole lecture with the words, keep on singing. And
Mm,
that is my message. Everyone can use the singing. You don't have to be an expert on singing. It's not a performance. It's a way of showing your love for your infant, and use the voice you have as a parent. And also the healthcare professionals will hopefully find more arguments and more information to the usefulness of singing in this context.
beautiful. Thank you so very much. It was such a pleasure having you here today, and we're looking forward to your presentation here at Gold.
Thank you.
Now, some information for our viewers. The presentation Family Centered Music Therapy to Manage Pain in the NICU by Dr. Alexandra Ullsten is part of our lecture pack, Effective Pain Relief in the NICU Tools and Techniques for Neonatal Comfort. This add on lecture pack is part of our Gold Neonatal Conference here starting June 3rd. If you would like to find out more information about this lecture pack, this presentation, and the entire conference, we invite you to go to goldneonatal.com for more information. Thank you all for watching, and we hope to see you at the conference. Bye bye, everyone.